All right. Well, it's 12:05, so I want to respect everybody's time, and we have a lot to cover. Welcome, everybody, to our virtual tour. My name is Tal Costa, CEO of Search, and I'm going to have Alexis actually introduce our guests today. So normally, when we were able to be together, Search would have van tours, and we would actually have a limited number of people because we could only fit 6 to 8 people in the van, and we would bring our friends, our donors, volunteers, and people who were interested in our work to get a glimpse of how it comes together, how we Search and our partners in the community have been able to take homelessness from a very high problematic level to a much lower one, and Alexis is going to cover some of that. But anyway, so today we want to try to replicate that, and of course we're able to do that with many more people since we don't have to squeeze into a van, but we can use the capability of virtual environment and really maximize our opportunities today. So I'm going to go ahead and turn it over to Alexis Loving, who is our VP of Programs, to kick us off. Oh, one more thing. So there is a chat function for those of you who are using your phone or on the computer on this and not necessarily the call. There is a chat option, and what I'd love everybody to do is to make a note in there, introduce yourself and how you are connected to Search or the Beacon or Temenos so that we know who's in the room with us here today. And then as you have questions, please type it in. So Alexis will look for those questions and then we'll manage the Q&A after. All right.
Tao, do we have the slides?
Yes. Are you ready for it?
You can pull it up. I'll just start talking though while you're picking them up. So hey everybody, thanks for joining us. So I'm gonna kind of kick off and we're gonna take this sort of like virtual tour the same way that we would do it on the van. So before we dive in, I wanna just lay a little bit of groundwork about homelessness in Houston and kind of what is so unique about it. So when you drive around Houston, I'm sure that you all notice the people that are living on the streets, what feels sometimes like an increase in tents and camps and people panhandling. And it can feel really unique to Houston and probably frustrating to see this in our backyard, but it's not unique to the city of Houston. It's something that all cities are struggling with all across the nation. And it's really fueled by many different factors, namely the lack of affordable housing. So I want to zoom out a little bit and talk about kind of from a national perspective, that 2019 data showed that 17 out of every 10,000 people in the United States experienced homelessness. So that's almost 500,000 people that represent a cross-section of the entire United States. And so in Texas, we made up about 4.5% of that population. It's quite high. Texas is a big state. And what we see across the country is that some of these very large cities with dense populations, of course, have the highest percentages of homelessness. Homelessness is associated with every region of our country, every type of family status, gender category, and racial and ethnic groups. But what we do see are some trends in large subpopulations throughout the United States. So one of those is individuals. 70% of the people that are experiencing homelessness across the country are singles. They're either living on their own or they're living in groups with other people, mostly male. It's highly defined by gender, and 60% of people experiencing homelessness are male. Unsheltered. So far too many people in the US are sleeping outside. About 37% of the overall homeless population are sleeping out on the streets and experiencing homelessness in a very literal sense, an unsheltered sense. So Tao, if you'll back up to that PIT data for me. So in Houston, we measure our homeless count annually in January, and it's a physical count where we look at the number of people who are staying in shelters and the number of people on the street. It's a really intense period where different agencies throughout the continuum of care, which is kind of like our collective body of people doing this homeless work, and volunteers from the community go out and we physically count people that are living in our region. And this year, you can see 2020's data all the way over on the right. And this chart is illustrating the downward trend in our PIT count data that we've had since 2011. And so what I like to highlight is that in 2011 is really when we started all coming together and working really strategically as a continuum of care. So again, that group of people under an umbrella that we call the way home. And so we strategically started making decisions about how we were addressing homelessness and how we were housing people, and a decision that we were going to end homelessness through permanent supportive housing and other permanent housing. And so this annual count includes Houston, it includes Pasadena, Harris County, Fort Bend. Houston's region is quite large. And like I said, you can see that steady decrease. There's a little bit of an uptick, right, when we had Harvey, which was to be expected. We don't know what it's going to look like yet from COVID. It's way too early to tell, but a lot of predictors are kind of pointing that we might see another uptick again, just because of the financial crisis that our country is facing. So we've managed these numbers and we've led the nation in Houston through our permanent supportive housing efforts and through our housing efforts and coordinated access efforts. All right, Tao, next one. So here's some of the, kind of the overall stats from the time of 2011 to now. So we've seen a 53% decrease in overall homelessness since 2011, which is very impressive. We've seen 42% of the individuals that were experiencing homelessness were living unsheltered in the last year. And 19,000 people total since 2011 have been placed into permanent supportive housing and exited homelessness. So of course, why we're doing this webinar today is because of COVID, right? We can't have you all here in our building and out on our tour to share, and COVID has impacted the homeless system in a lot of ways. Here's just kind of like a sampling of some of the news headlines that are showing up and have been showing up over the last couple of months. So COVID's placed a lot of additional pressure on our system. And many of the clients that we serve are considered really highly vulnerable. Unhoused people are among some of the most sick individuals in our society, and they're unable to follow the CDC's most basic virus fighting directive, which is to stay home. So staying safe in this pandemic has meant access to good information, being able to know how you can keep yourself healthy, what's really happening, how to get tested. And for people living on the streets, they don't have access to good news and good information all the time. The homeless shelters and service providers, we don't have the physical space to be able to distance and serve all of our clients safely. And so unfortunately, it has meant, some closures and some changes to service that make it a little bit harder for our clients to get their basic needs met, like food and hygiene. And the conditions of COVID are really, risky for a healthy person. But our clients are disproportionately experiencing things like lung disease, heart disease, cancer, hypertension, factors that make COVID much more deadly if contracted. And additionally, a lot of the clients that we serve are over the age of 50. And in homeless services, our clients age prematurely. So physiologically and medically, even though they're only 50 years old, their body is more like that of a 70 or 80-year-old. And so COVID is particularly dangerous to this population. So kind of considering all of this, one thing that's really important is that we consider housing as healthcare. And so the journey to get people off of the street and into housing is a really, really important one. And so today we gathered some of our partners from the Beacon and from Temenos CDC to kind of talk about this work that we do together under the Way Home, which is a group of 100 plus organizations that are all working together to do this work and move people out of homelessness. Today, we want to kind of focus on what one of these partnerships and pathways looks like, which is from the street and search serving through outreach, through the beacon helping to stabilize and assess and navigate individuals into housing, and then what it looks like on permanent supportive housing, the housing entity that helps keep people housed and in a safe and stable environment. So we've got some great partners here, and I'm going to kind of start on that front end of outreach, and I'll introduce Sean. Sean's our team lead at Search. He works with our outreach teams. There's a couple different outreach teams at Search that make up one big group, and so I'll turn it over to Sean.
Thank you, Alexis. Hello, everybody. My name is Sean Quitsaw. I'm the supervisor for the outreach team here at Search. And like she mentioned, the outreach team is made up of a few different sub-teams, each with kind of a different piece of the outreach pie. But today I really want to focus on, I'll give you kind of a brief overview of what outreach does and then how outreach has been affected by COVID, because it's had an impact on all of us, both us in the service provider realm and then the clients. So outreach, as she showed on that last slide, is really the first point of contact for individuals who are unsheltered. And so really the goal on outreach is to build a rapport with those individuals, to assess their level of vulnerability. So outreach really most often focuses on those who are most vulnerable, those who are not already connected to services, who are not as likely to come in for services. And so that's really where our focus is most of the time, is on assessing that initial level of need and then working with them on gaining access to housing, health resources, and income if they don't have any. What that often involves is getting individuals the documentation that they need for housing and then kind of moving them along that process. So pre-COVID, outreach really was in the field most days of the week. That's kind of our bread and butter. That's where we want to be, is working with those clients where they are on the streets. Of course, with the impact of COVID, Search had to shut down services temporarily, at least in terms of meeting clients in person. And that had an impact on the way the outreach team was able to deliver services. Like the rest of Search, for at least the first few weeks, all of our meetings were virtual. We were not able to be in the field with our clients. So on the first slide that I show with some of those pictures, you'll see us meeting virtually. I'm trying to make the best of the initial weeks of the shutdown. But after the first couple of weeks, the Search outreach team was called together with some of the outreach teams across the city to meet the need of the individuals living on the outskirts of town. So luckily we have providers like the Beacon and Healthcare for the Homeless that are operating within the downtown area and are able to serve the unsheltered individuals living in downtown. But our focus ended up being on those individuals who did not necessarily have access to food, who did not necessarily have access to the health resources or the screening tools that they needed. And like Alexis mentioned, because they're unsheltered, they are particularly vulnerable and particularly at risk of being negatively impacted by the virus. And so that's really what our outreach focused on, for the first 2 to 3 months, was getting people screened for symptoms of COVID, passing out health information, and then passing out food and hygiene kits, because many agencies, not just Search, had to either partially shut down or are still shut down to this day because of the impact of COVID. So that really was our focus, was on meeting the immediate basic needs of the people that were on the streets, and then making sure that none of them were displaying symptoms for COVID. And if they were displaying symptoms, getting them connected to that screening process and then those health resources. And I believe our team only really encountered one client on the outskirts of town who seemed to be displaying symptoms. So we screened them for those initial symptoms. We got them connected to a health worker over the phone who did another screening, and then used a taxi to get them transported where they could be tested further. Luckily, that test came back negative. But that's just kind of a quick overview of that testing process, right? When you're meeting somebody in the field and they seem to be displaying symptoms, going through that initial screening and then getting them connected to the testing, and then an eventual quarantine if they do ultimately test positive. So luckily, we only had one close call. And it shows that, I think the safety protocols that we've used in terms of using distancing, wearing masks and gloves in the field have helped to keep our clients safe and also keep us safe in the field. So that's really what the first kind of 2 to 3 months focused on with the outreach, during the quarantine period. But luckily, as Search has kind of started to reopen our building on a partial basis, and then also pivot back to our normal case management, that has also allowed the outreach team to get back to our bread and butter. Our normal case management of getting people, connected to housing, health and income resources, and assessing that initial level of need. So, with the building reopening, we have started to focus on passing out water and other basic needs items, but also using our front gate of our building as kind of a triage zone. So, because Search is near downtown and a lot of the major encampments, there are a lot of unsheltered individuals in the area who depend on Search for a certain level of case management. And so this is where we have, using our building at a limited capacity, we have assessed that need at the front gate and have opened up client meeting spaces in our building. As you can see with the photos, we've taken great care to make it safe for both our staff here at Search and then the clients that we're meeting in our building spaces. So we have a limited number of spaces to kind of make sure that we don't have too many of the people in the building at one time. And then of course, we, before we bring anybody into the building, we screen them for symptoms, take their temperature, and then utilize these designated spaces. But so with Search reopening, kind of using all of the knowledge that we've learned up to this point, with the safety protocols, getting back to our normal case management, in a certain way, actually, certain aspects of our outreach and housing work have actually gotten more efficient. So in terms of the housing navigation piece, our outreach team does do some housing navigation, and that work has continued throughout the quarantine period. And we've been able to get back to that work a little bit more as we've gotten back to working in the building. And so here in these photos, you'll see, in the first photo, we have one of our outreach clients filling out a housing application, which is part of the navigation process, kind of, one of the final steps before getting housed. And then in the photo on the right, you see a client that I actually personally navigated from the streets into housing, and that is her moving in. She actually moved in early July. So, I think with outreach, there were some initial challenges. We had to adapt, given the risks associated with COVID. We had to adhere to public health recommendations and safety protocols, but still wanted to meet those basic needs. And then as we've learned through that process and felt comfortable with those new safety protocols working in our building, again, getting back to our normal case management, we have still maintained that momentum around assessing people's needs and getting them connected to housing and income and health resources.
Thank you, Sean. So next I want to introduce Becky Landis from The Beacon. The Beacon is a wonderful partner with Search. We have worked together extensively for many years, and the Beacon plays a really critical role in our system always, but has definitely kind of pivoted to serve the homeless community in some really unique ways during COVID to kind of respond to some of those challenges that I shared before. So with that, I will turn it over to Becky.
Thank you, Alexis, and appreciate everybody joining us today to learn a little bit more about what we all do. And the Beacon actually started back in 2007 by Christ Church Cathedral, which brought a number of missions that they were doing to serve vulnerable members of the community and the homeless community under one umbrella as a separate nonprofit, which became the Beacon. And we are located in the heart of downtown. We've got multiple programs that are functioning remotely now, but our primary facility is the John S. Dunn Outreach Center, which is located at the corner of Texas and San Jacinto. So this is, and I wanted to talk a little bit more about our day center. As Alexis mentioned, we definitely have pivoted during this time of COVID. That photo that you see on the left is what our day center would have looked like on a typical day prior to the onset of the pandemic. And we, utilizing the homeless management information system like Search and Temenos and many of the partner agencies across our collaborative, we would check in daily, about 5 days a week, men and women who were experiencing homelessness, many of whom has, as both Sean and Alexis mentioned, health conditions, chronic health condition, disabling conditions that make it a real challenge under any conditions for living, and especially challenging at living out on the streets, and some of whom have lived out on the streets for a long time. So they would come in and we provide a hot meal, access to other basic needs such as laundry and showers. As mentioned, the Beacon is one of the core centers for the coordinated access piece. So we're assessing vulnerability, which is also that first step in that pipeline of navigating folks into housing. And you'll see on the left side that how we've repurposed the space during this time. And I really have to give it to, especially to our frontline staff. We've got about 10 or 12 staff that have been working consistently since March 13th, when we formally shifted and modified our services due to the pandemic. And due to the staff commitment, the support from our partners, and especially from the city in helping us secure quickly PPE, we've been able to really be open every day since then. And we were serving 5 days a week. We've extended that to 7 days a week. And you can see that on the right-hand side, and if you'll bring it back a little bit, thank you. You can see the markers on the ground where we've kind of put in place distancing measures. Also, as Sean was mentioning, making sure that we're doing things safely with masks and the appropriate equipment. So that's really a sack lunch preparation area. We also have in the facility a commercial kitchen, and we're now preparing about 700 meals a day, 7 days a week. And our meal production has actually gone up about 300% since the same time period in 2019. What we learned very quickly is that also, as Sean mentioned, some of the partner agencies just had to close down either partially or indefinitely for a period of time for several months, in particular some that were providing meals. So that was a gap in services that we really felt like we needed to try and fill in, and we're continuing to work to do that. We also are now in this same space that you see. We can bring in people a few at a time for laundry and showers in that part of the building. We're doing the housing assessments, set up also at workstations with plexiglass in between to make sure we can do that safely. One of the other services that we are bringing people in or checking people in for is access to mail. That is a service that we provided before, which has become especially critical during this time. Prescriptions are often being mailed out now, whereas before individuals were able to go and pick up their prescriptions. So that's just a critical service for folks. Stimulus checks that are coming in the mail, and other disability checks, and other really important pieces of mail. So this photo is outside of our facility. And you can see basically by how the line is that this is one of the things that we've struggled with, the distancing outside of our property and helping people to do that. Um, Basically here we have men and women who are lining up to come in or to come for meal services. You can kind of see in the back of the photo, there's a porta potty that one of our partners, the Downtown Management District, had installed actually prior to COVID. And since COVID, they've installed a hand washing station to really help with hygiene and sanitation as well. And we've also been giving out hygiene kits in addition to that. And so if you'll move to the next slide. So this gives you a sense of what our operations look like now in terms of the meal distribution. As I mentioned, we're giving out about 700 meals a day. This is outside in our courtyard. So the hot meals and the sack lunches are prepared inside the building with staff and volunteers. Because of the increase in meal production, we've actually added 4 staff to help with that piece in particular. And we're so grateful to continue to have volunteers coming in to help us 7 days a week. But we also understand that for some of our volunteers, especially those who have underlying conditions, it's still not a good time for them to come in, especially if they're working alongside other staff or volunteers, or certainly outside and in the distribution piece. So we're seeing less volunteers, but they're still really important to us. And we utilize about 12 volunteers every day for the meal production and distribution. So in the styrofoam containers, a hot meal, and then the sack lunches, and you can see that those are distributed. We try and definitely do that outside. It's safer also to keep people moving very quickly. So all of the meals are takeaway in particular at this time. And we're committed to continuing the 7-day modified services on a month-to-month basis. We're committed through the end of September, and then we will reassess depending on what other services are happening in the community and what our clients' needs are. But as Sean mentioned, we've really focused and on the basic needs. We were doing it before, but we're seeing that is so important at this particular time. And you can see by the, you don't mind going back at the back, we are definitely, of course, in the downtown area. I just wanted to mention a couple of things that we're seeing differently in downtown. One, some of the clients that are coming to us, we are seeing new people coming, some of whom are newer to homelessness. They may have been staying in with a friend or family member and are no longer, due to the pandemic, able to do that. And we have other folks that were homeless, but in some of the outskirts of the Houston area, and there's less access to services. So they've kind of migrated into the downtown area. And the blocks around the Beacon, there's actually an encampment that's sprung up just about a block from us, where there's good, safe lighting. There's not a lot of people downtown right now as the businesses haven't started reopening. So we're seeing people staying around the area 24 hours a day with all of their items. So that is definitely something new and different. And I know that will be a focus as some of the dollars start coming in from CARES Act funding to be able to move people through this process. One of the things that's important to us, as it is, I know, with Search and Temenos, is that those partnerships with the organization. So our facility, since we've been in operation and can bring people in safely one at a time, we have organizations we have navigators, like Sean mentioned, that can come in and visit with people one-on-one, and really try and keep those relationships and keep that engagement with the clients. We've noticed that that's probably the biggest challenge, whereas before in our facility, we could walk around and have those conversations very safely and easily with those large number of people, and it's just not happening in the same way. So we want to make sure we're not losing touch with people, and we're continuing to try and engage them, not only in the basic needs services, but in the housing assessment and other services, so that we can make sure that we're able to best support them in those next steps. But those engagement pieces are definitely more of a challenge than they were prior to COVID. I'm guessing that's the same with some of the other organizations as well.
So Becky mentioned coordinated access, which is basically, I mean, we could do a whole session on coordinated access, but the short of it is that it's a centralized system where we assess people and we try and determine the housing solution that's most likely going to end their homelessness. And we prioritize people because housing is such a limited resource that we try and do it in an order to get the people who are most vulnerable housed first and with the solutions that are the most complex and comprehensive, right? So one of the roles that Search fills in the system, and we work alongside the Beacon, is to assess individuals who are living out on the streets or experiencing homelessness, and then we navigate them into housing. And that could be lots of different forms of housing, but one of them is permanent supportive housing. So that is matched for individuals who are experiencing chronic homelessness. And so one of Search's partners in Housing Solutions is Temenos CDC. And so I'll introduce Eva Thibodeau, who is the CEO of Temenos.
Thank you. I'm so happy. Thank you to everyone who joined today and is, taking an interest in this. As Alexis mentioned, Temenos CDC is the housing aspect. This is where, when all that pre-work has been done around identifying people, talking to them, working with them and getting all the paperwork together, where they finally come home to stay. And so Temenos was actually founded in 2006, and it was founded through St. John's United Methodist Church as its own, nonprofit, freestanding. But it was a response really to the problem that St. John's was seeing every single day. St. John's literally backs up to the Pierce Elevated, and every day, the staff and the parishioners were seeing the folks who were living under the Pierce Elevated and other places, around downtown, who were unsheltered. And back before 2012, when Alexis talked earlier about there being a real shift in how we approached ending people's homelessness, oftentimes it was survival of the fittest for folks who were experiencing homelessness to get their needs met. The system was not designed at that time to really go out there and try to work with the hardest to reach, as it is now. And so Temenos was formed to provide permanent housing for those folks who couldn't make it to the front of the line on their own. Since that time, it has been, I'm very excited to say, we've been able to become part of the coordinated access system, and we now work, and every single tenant in our buildings is navigated in through that coordinated access, meaning that they were triaged and assessed to be some of the most vulnerable and highest need folks, and that's who we house. Temenos has 3 buildings. We have about 140 units. We house single adults, so they're small micro units that have a small kitchen and a bathroom and a kind of living, sleeping area. So we've talked a lot and alluded to this magical beast called permanent supportive housing, which is one of the ways that people, especially the most vulnerable within our homeless system, which is one of the ways that folks are housed. And so this is a very unique, very specialized type of housing, but at its simplest form, basically you get a new home with a standard lease, the type that anyone else in the community would sign. You get property management, who in our case, because we are specialized in our 100% permanent supportive housing, you have property management who's really committed to retaining residents and giving multiple chances to folks. And then you add, and this is the real key ingredient that is what helps people stay housed, supportive services. And so we have on site at each of our properties, we work with Search, we work with Healthcare for the Homeless. We have office space on site where there's case management, there are nurse practitioners, there are peer specialists, there are licensed chemical dependency counselors, all sorts of folks on site where people are living to be there to really help end their homelessness and make it permanent. And so you can see some of our staff there. This was immediately post-COVID and the stay-at-home order. And our staff are essential staff. They, are at the desks 24/7, maintaining the security and the safety of, the residents and the properties. It's maintenance, it's housekeeping, making sure that, everything is sterilized and keeping running. As Sean talked about, we are still accepting residents during this time. And if you want to go back real quickly to the first slide, on the right-hand side is Adam. And he was navigated into one of our properties. This is our Knowles Temenos property. And he moved in just a few weeks ago and is getting acclimated, but after a very, very, very long stay on the streets. And so that in a nutshell is what permanent supportive housing is. Next slide. So pandemic hits. All of a sudden we had no phones, there was no testing, there was no food, we couldn't have visitors. Our supportive service staff were temporarily not on the property. And there was mass panic of our tenants. And so, we had to really problem solve and pivot to try to figure out how to work in this new space and in this new reality where we had 140 folks housed in our buildings. And, how do you manage that? And so some of the things that we found really early on were that while folks were able to, for example, access their supportive service case manager or healthcare worker via phone, most of our folks don't have phones. And if they do, they're the free phones. And so they have limited minutes. And so they didn't want to use their minutes always to, get their supportive services case management needs met. And so we went out and we got free cell phones and placed them at each property so that tenants could check them out so that they could maintain connection, with their supportive services. Folks, many of them, I would say probably about at least half of the folks in our buildings do not have any income, like 100% zero income. And because they're single adults, they also do not have access to SNAP, which is the food stamp program. And so with pantries in the area, food pantries, that is usually how folks access food, and places such as that being closed because they didn't have volunteers and because people couldn't walk in. And the few that were open, and most of the food bank places, were drive-through only. So that it was, touch-free, all very, very, very pandemic and, public health oriented. We only have about 2% of our population who have vehicles. And so without being able to walk up to places, we were seeing incredible food insecurity. And so we quickly got a Costco card. We got some changes in our grants so that we could purchase large quantities of food. And, we tried to make sure that people at least had some kind of subsistence food that they could survive each week on. At the same time, we worked with Search, and Search communicated with the food bank, and we had kind of a dream come true, which has been fantastic. We have, as a system, we have long recognized the food insecurity of folks living in permanent supportive housing. And the food bank really stepped up to do business differently. And every day since mid-April, the food bank has been delivering hot meals that we then can, if you can see in the lower right-hand corner there are some of the Search staff and volunteers that then we then put into, individual serving containers and are serving all folks at all properties. So everyone is getting a hot meal a day. It has been absolutely fantastic. And then we've also been able to get household boxes of food delivered for our residents. We also, you'll see we have a commercial kitchen at one of our properties, and pre-COVID, we used that kitchen to prepare 3 meals a day just for the residents of that site. We changed that, and we actually are now serving, it had been 15 folks who resided there. We now serve about 40 people every day, 3 meals a day, who do not have any other food options, and we're going to continue that. So, I think what we'll find going forward, and we could all probably speak to this, is that, there are practices that will change forevermore, and there are learnings that have come out of this that, have made our work better. And so this is one of those things that, that we'll keep doing. We also recognized that, particularly at the beginning, the only way that people could get tested was if you had a car and could drive through, one of the city or county testing sites. And that was really concerning to us. Again, I, talked about how our folks don't have cars. And just like the rest of the population, they were scared. They were concerned, and many of them did want to get tested. And so we worked with a partner organization, Bread of Life, and we actually were able to bring testing to our places. And so you can see one of our test sites up in the right-hand bubble there. But we did walk-up testing, and we've continued to do that every Wednesday where people can walk up or drive up. And so we're trying to meet that need. It sounds silly, but if you think about your own life, I know that, I call the YMCA my mental health membership. And, that ability to work out and to be physical is really, really important to me. And I know that it is for many of our residents, and in particular, some of our residents in their 20s. When I was at the downtown Y in the mornings, working out and leaving, I'd see them coming to play basketball. Well, basketball indoors and in public is a thing of the past. And so, some of our young folks have just really, really been struggling. And so we got a basketball goal, and, we now have basketball, out in the parking lot. And, just to be able to be out there and shoot around, for one young man in particular has made a huge difference. As I said, our workers are essential workers. There are exactly 2 of us on staff who could potentially work from home or do remote work. Everything else is hands-on and in person. And so we immediately instituted hazard pay for all of our hourly staff, and have also taken this really as an opportunity and a time to look at what is a living wage and, what is fair and equitable. And so for the long term, again, one of those things that have come out of this, is really making some pay adjustments to make sure that we're valuing the work that our people are doing. And then we worked with the city, with the mayor's office, and with multiple partners to make sure that everyone has protective gear. So, that's both the tenants. I search, and Don Hall, who's in that lower right-hand picture there, who's a longtime searcher and good friend, colleague, worked to make sure that every single tenant had at least one mask. And we, now that, masks are more available, we make sure that in all the common areas, we're asking folks, do you need a mask? Do you want an extra? We're throwing masks around like confetti, have a mask for a friend. But, really just trying to work to make sure that people are staying safe. So, when I kind of pull out and look at what are our big overall goals here? We are about safe, quality, permanent housing. Again, this is not a temporary solution. People can stay for as long as they want to remain tenants with us. We are all about tenant retention. We don't want turnover. Turnover in our mind is not a positive thing. If somebody leaves, we want it to be because they're going to a different housing option of their choice. So that means that we do a lot of eviction prevention. And so that's, when the eviction moratoriums came out, countywide, statewide, federal government, all the different guidelines, we really operate in that mindset on all days of the year, not just during a pandemic. So for example, we might have someone who vandalized a washing machine, in one of the laundry rooms overnight because he was drinking and got upset and decided to get in a fight with the dryer door. So, instead of saying, that's it, you're out, you vandalized property, you destroyed things, we're going to talk with the supportive services staff, and we're going to say, hey, look, we can't have damaging property, but can you work with this tenant to try to figure out a way to prevent this from happening in the future? And so we work really closely. Or if someone is having a hard time paying, supportive services might kind of come to the bat and say, look, this happened and this happened. Can you work out a payment plan with them? And so, we will do that. the question on the table is always, how do we keep this person housed? And if for some reason it absolutely isn't working, we work really closely to try to make sure that that person is moving into other permanent housing, not going back to the streets when they leave us. And again, I think you've heard this throughout all of our presentations, but collaboration is really key to making this work. You know, no one in this type of work should try to be a jack of all trades. We all have things that we and our staff and our spaces are especially skilled at. And we've really come to put trust in each other so that we really are ending unsheltered homelessness for all Houstonians.
All right, so we would love it if y'all would share some questions with us so we can, you know, try and kind of direct the panelists towards things that you're most curious about or most interested. It's one of my favorite parts of doing the van tour concept is that you get to spend this time checking in with us and telling us what you care about, what you want to hear more about. Doesn't have to be directly related to anything we talked about today. And there's no such thing as a stupid question. Really, please throw it in the chat box. Okay, there's a question about the meals at the Beacon. Are they open to anyone who walks up? So Becky, can you answer that?
Right, that's a great question. Initially, when the pandemic kind of hit and we all started shifting our services, we were not able to safely do the intake piece for people who were walking up for meals. So at that particular time, for a few weeks or about a month or so, we were really not screening people. And we knew that there were some individuals that were, for example, in permanent housing, but didn't have a kitchen access at that time, who were coming for food. But over the past couple of months, we've honed back in to get back to really serving that core population. So the meal services are for folks that are literally homeless, that are living out on the street, and that's the population that we're focusing on. So if someone walks up who is not homeless, and if they're new to us, we will do an intake and find out what their situation is. If they're not homeless, we'll make every effort to refer them to the services that they're needing. If they are homeless, we'll enroll them, and we understand that there is a huge number of folks that are extremely vulnerable right now to falling into homelessness, and we're very mindful of that and want to get them connected with a food pantry if they're still housed, or somewhere where they can get those needs met. But our core population for food is going to be those that are literally on the streets.
Okay, so lots of questions coming in. I'll take that first one about temenos and income because it's kind of it's a big question. So individuals who are going into permanent supportive housing, who pays for their housing, basically. So most of the clients are on some type of subsidized housing, and it comes in lots of different forms. It could be a voucher through the Houston Housing Authority or the Harris County Housing Authority. Sometimes it's directly through grants that different organizations have. But in general, it's that individuals pay 30% of their income towards their housing, and those programs pay the remaining balance. So Eva, if you want to piggyback up on that, you're a whiz, and then answer the next one too.
Yeah. So no, absolutely. So the whole goal is that, and this is the Housing and Urban Development, national goal, is that folks who are exiting homelessness will not pay more than 30% of their income in rent. And so, yes, that means if you have zero income, 30% of zero is zero. And so the idea is you match them then with a subsidy to cover the operations. So the other piece, I think it was about how full are we, and is there more housing coming? If I remember the order that we strive to be at 100% capacity. The need is so large out there, for folks who need housing. And so we turn over our units as quickly as possible. There is a pipeline of folks who are always being kind of navigated into permanent housing, and our doors are open to accept them. And yes, we need a lot more. And, one of the things that will come out of some of the Harvey disaster recovery money is that we will have additional affordable housing. Both the city and the county are dedicated to making sure that a lot of that replacement housing is affordable. So that's multifamily affordable. And our partners over at Change Happens, they got funded and they are building new housing like this. Our partners at Magnificat House got funding. They're going to be doing this. Temenos has funding in order to do additional properties. And so, yes, there also, though, I don't want to neglect to say that we work system-wide with many, many private landlords. And so, there are a lot of people right now in the community who are out there living in a typical apartment. And so our model of housing is one model, but know that, we utilize mainstream fair market rent all the time, as long as a landlord will take that subsidy.
Yeah, about 50% of the permanent supportive housing that Search case manages is in a congregate setting like Temenos that Eva's describing. The other 50% is in that kind of scattered site model, which she's alluding to out in the community, right? And there's a question about kind of has the pandemic created more difficulties in housing people? I would say in many ways it did, especially initially. Simple things like trying to transport clients to be able to go look at housing units, to complete paperwork, to get signatures, that kind of thing was very challenging in those first couple weeks and months. Luckily, our system has really worked together to make a lot of allowances. We've gotten different waivers from funders about what signatures are required, what paperwork has to be completed when. And we've also worked closely with the Housing Authority to change how we do inspections and different processes that used to have to take place in person are now able to happen virtually. And so that's been a game changer, and we've really been able to house kind of, I would say, on par in recent months with the speed that we were doing before. So I think it's a big nod to all of the agencies that are able to do that and the flexibility that are required. Okay, some questions are getting answered, I think.
One question that I've been getting from just friends and supporters, and Sean, I don't know if you can speak to this, or Becky, you alluded to it a little bit, but it's about, the anticipation of what is to come or what is maybe already happening as far as newly homeless. What are we seeing? What are you noticing?
Yeah, I could speak to that a little bit in terms of, with clients walking up to our building at Search seeking services. I do think we are seeing a higher percentage of people seeking services for the first time. Clients who do not necessarily have a documented history of working with us or working with any homeless service provider. So I think we are seeing an uptick in those cases, which I think is indicative of, the increased level of need, people losing income, being evicted from their apartments, due to lack of income. And I think like was mentioned before, I think it's hard to predict exactly what that will look like on a macro level, but we are seeing at least a taste of that.
And I can add that we definitely are seeing an uptick in new folks new to homelessness coming to us. One of the things that we're also seeing, and this is because of the lack of ability to go to Department of Public Safety or to the Social Security office or to some of the organizations that have traditionally helped with identifications, that is becoming a huge need for the folks that are coming to us, especially if they're at the point where they're ready and working with a staff person, a case manager, a navigator to go through that process to get into housing. So we've actually shifted some of our staff resources to help specifically with identifications. especially with those clients that are already in navigation. That's something we're starting to do. And we've taken on more complex identification and birth certificate cases through our legal team as well, to make sure that those services aren't kind of falling through the gap. So that's something that we've definitely seen, that I've also heard from some of the other organizations, in particular in the downtown area. They're seeing that as well. IDs are so important for anything that you're going to do next, whether it's housing, looking for work, access to benefits, access to healthcare. It's just so critical.
Well, we have come to our 1 o'clock time. I want to thank all of our friends, and Alexis, Sean, Becky, and Eva. All of you are just great experts and great contributors to this. So we have records of all the comments and questions. And so if we haven't addressed your question directly, we will definitely get back with you. Please feel free to email us, call us, somebody in this group, I'm hoping, and so that we'll stay in touch. So we will revisit it again in the next few months and see how things are going. So thank you for joining us. Bye.
Thank you so much.
Thank you.
Bye.